Well, welcome everyone. It's great to see so many people have joined us tonight. This is our Living with SADS series tonight on supplements and drugs to avoid. I'm Marcia Baker, the program director for the SADS Foundation. A couple of reminders before we begin. Please keep your audio muted during the presentation to improve the sound quality for all. Your video camera is certainly optional. We love to see your faces. Following the presentation, we've allotted plenty of time for your questions. You may type your question in the chat anytime, and we will address those following the presentation. You may also unmute yourself and ask your questions verbally if you like during the Q&A session at the end. And now it's my pleasure to introduce our presenter, Dr. Will Heise. Dr. Heise is a medical toxicologist and family physician who joined the faculty of the University of Arizona in 2015, and he became a member of the Credible Med Scientific Review Board in 2016. He earned his medical degree from the University of Iowa. He completed a residency and fellowship at Banner University Medical Center, Phoenix, and is board certified in both medical toxicology and family medicine. He has appointments at the University of Arizona College of Medicine, Phoenix, in family, community, and preventative medicine, biomedical informatics, and medicine. He's actively involved in the divisions of clinical data analytics and clinical decision support and the division of medical toxicology and precision medicine. He practices with this department, medical toxicology at Banner University Medical Center and Phoenix Children's Hospital. Well, we're also honored to have Dr. Michael Ackerman. Dr. Ackerman is a genetic cardiologist in Rochester, Minnesota, where he directs Mayo Clinic's Wyndham Smith Rice Genetic Heart Rhythm Clinic and the Wyndham Smith Rice Sudden Death Genomics Laboratory. Dr. Ackerman is a professor of medicine, pediatrics, and pharmacology at Mayo Clinic. He also serves as president of the SADS Foundation's Board of Trustees. We are honored that both Drs. Heise and Ackerman are volunteering their expertise with us tonight. So thank you both for your time. We appreciate it very much. On behalf of the SADS Foundation, I want to express our appreciation for support from Medtronic to help make this webinar possible. And now Dr. Ackerman would like to say a few more remarks.
Great. Good evening, Marcia, and hello to every one of you out there in SADS Foundation. Living with SADS webinar land. It's great to get to be with you. And I just wanted to thank Dr. Will Heise for doing this. I really appreciate you and all that you do at Credible Meds. I think every family who's affected with long QT syndrome has the Credible Meds app on their smartphone. You probably will discuss that. It's an incredible resource. And I've been privileged to work with its president and founder, Dr. Ray Woosley, who's just an incredible person, gentleman, scientist, physician who has really tried to be extraordinarily helpful for families with this issue of drugs to avoid. And I'm looking forward to Dr. Heise's presentation. He will be fielding your questions along with Marcia. I have another commitment, but I just wanted to give you a greeting and thank you for joining us tonight. And if there's leftover questions, join in on Friday for our SADS Live program, and we'll pick up and answer any of those. I just want to say I take care of over 1,700 patients with long QT syndrome specifically. And some of you are on the call, and it's just a privilege to take care of families affected with this specific genetic heart disease. It is National Doctors Day, and it's absolutely a privilege and an honor to be some of your own doctor. And many of you know that, and this is to set the stage for Dr. Heise's comments, the drugs that are on that QT, what I call the QT hit list, are not categorically off limits to you. They are off limits for any prescribing physician called not your long QT specialist to just willy-nilly prescribe to you without our explicit permission. That's the critical thing. I have many long QT patients who have their ADHD very effectively treated by medicines on the credible meds list. I have many long QT patients who are struggling with mental health issues of anxiety and depression, and they have their anxiety very well treated with medications, the SSRIs that find their way on the hit list. I have many patients with concomitant asthma who have their asthma well treated by not depriving them when they need that albuterol inhaler therapy. The difference is we know about it together. We're thinking about it together. We're approving it together, as opposed to a family being sneak attacked and blindsided by somebody prescribing one medicine on the list and then somebody else another medicine on the list, thereby creating the perfect storm. And it's always the perfect storm that does a long QT patient in, if you will. And when we short circuit that perfect storm by having you well diagnosed and well treated for your long QT syndrome, we actually create a lot of safety margin to enable the possibility that it may make sense in a patient by patient risk benefit scenario for you to actually take a medicine that resides on the credible meds QT hit list. So it's an incredibly important resource. It's an important list. But I think one of the challenges that we've had in the past is moving from the notion that those medicines are 100%, 1000% off limits, as opposed to those medicines are timeouts. Have we done our due diligence? What's the risk benefit equation? Is there margin to add that medicine to your treatment program? And that's where you need to always review that with your long QT specialist. And so hopefully that sets the stage for Dr. Heise. So I'm not going to take any more of his time. And Will, I just appreciate you taking the time out. Appreciate all that you do at Credible Meds, and thanks for your work in this. And to you, happy National Doctors Day. Thanks, everyone.
Thanks, Dr. Ackerman and Ms. Baker. I appreciate it very much. Yeah, that is one of the things that we always have to say as someone who has done primary care in the past and now mostly does medical toxicology. I recognize that we have a tendency to demonize drugs and supplements and other xenobiotics. And in reality, we recognize that there's always a risk continuum with these, and that there are some things that are acceptable and helpful, and that there are others that are problematic, right? Just because something is known to cause torsade does not mean that it's going to cause torsade in every individual. What I'm going to do tonight is try to go through a number of supplements and a few drugs. There were some questions that had come through repeatedly to the SADS Foundation, and so some of them are medications. Most are going to be supplements that we're going to discuss. And again, none of these are things that are guaranteed to cause problems, whether it's long QT or whether it's Brugado or some other ion channelopathy. I'm going to try to balance the risks and the benefits of each of these things to give you an idea of what's truly going on. So the first thing is that I don't have any financial conflicts of interest. I don't have any stock or money in any of these things. I do serve on the crediblemeds.org scientific committee, but that's on a volunteer basis. I actually don't get any of my salary supported or paid from any of this. I do it because it's an opportunity as being part of a scientific medical faculty, and because I think that it's worthy of my time. So what we're going to do is review safety and some efficacy. Efficacy will come up as we talk about risk-benefit balance, but I won't go into deep, detailed studies on any given particular drug or supplement in most cases. And many times you'll hear me say that there is no data or there's little data on some of these, and that's just the way that things work out. So these are what we're going to be talking about, the specific kinds of disease states tonight: anxiety, weight loss, performance enhancers, hormonal treatments, because that came up repeatedly, and then a few other kinds of supplements that are commonly utilized. So again, a brief disclaimer, of course, is as you know this group more than many of those that I talk to, there are many different kinds. This is not to suggest that these are the only kinds of channels, but just to give you the idea that when there's lots of these different ones, there's lots of different things that can occur in one individual compared to another. And I'm going to try to give you, in general, those that are particularly active in terms of cardiac channels, and we'll talk about avoiding those. But it's not, we will do a little bit of QT specific data because I can't help myself, but we'll try to kind of talk about all of them in general. So the important thing when someone is coming in with an anxiety disorder is, first proper diagnosis, right? Is this intermittent? Is this a panic problem? Is this a generalized anxiety disorder? And that will determine to a certain extent what drugs are going to be most safe to utilize to treat it. The benzodiazepines, as you probably know, are very effective for short-term use and for panic disorders, but for long-term use and for folks who have generalized anxiety disorder that affects their daily lives over an extended period of time, it's important to be on a controlling substance. And so lorazepam and diazepam are those that are probably quite safe in this setting because of their effect on GABA receptors, as opposed to anything that affects sodium channels, whether that's supposed to be in the brain, but may also involve the heart. Buspirone and duloxetine have been reviewed by our group and appear to be safe. In general, the tricyclic antidepressants, which are an older class of drugs, which are quite inexpensive and very useful in many cases, should oftentimes be avoided. This is also true for citalopram. Citalopram is one of those drugs that is really commonly used, and that, as Dr. Ackerman pointed out, you may be able to be on, and with a discussion of risks and benefits, but there are probably better ones for those, particularly with long QT syndromes. I have a link here where we have on the Credible Meds website now therapeutic options. This gives options that we have reviewed and that we found no evidence that they cause long QT issues. These are just a few of the things. It goes through a lot of the common things that you would expect in terms of medications, both for over-the-counter as well as for those that are prescribed. And we tried to pick those disease states that were most common and that we thought would be really helpful to have available to folks who have SADS and long QT syndrome. All right, so a couple of disclaimers about supplements in general, right? And that's that supplements tend to be relatively loosely controlled by the FDA. They come in, they don't have to demonstrate any efficacy at the time that they go on to market. They may or may not be efficacious in many cases. And just because they're able to put them on a store shelf does not mean that they're safe. It's really common. There are good brands and there are poor brands, and there are lots and different lots in terms of how safe things can be. It's really common that there are mixtures, and so it's critically important that you take a look at everything that's in there rather than just the first ingredient. The we're taken is fish oil personally, and I did it for a while because of heart health and long-term issues. I did my cholesterol at the beginning of the year and then used fish oil and then did it at the end of the year, and there was a difference, but it wasn't enough that I kept doing it. And the other thing about supplements is it takes time for them to be demonstrated to cause problems in humans, and then it takes time for them to be removed from the shelves. A classic example is fen-phen, which many young ladies were using, and it took almost a decade to remove that from the market, even after it was clearly demonstrated to cause heart valve abnormalities. And so this is to give you a realistic idea that sometimes some supplements can be very helpful, but be aware that they can contain other things and that they may not contain what they say, and that it takes a long time for them to be removed from the market when they are not safe. All right, so we're going to talk about weight loss. This is my favorite way of consuming food. That is, of course, a beautiful marinara pizza. So I went through the top 10 list and we looked at those things that folks had sent in to the SADS Foundation in order to find those supplements that we thought would be most helpful to discuss. So the first one that we're going to talk about is Garcinia cambogia, which is a small fruit or vegetable that looks like a small pumpkin is how it's been described. Now, to me, I don't know, this inside looks more citrusy than like a pumpkin, but you know, whatever. So the active ingredient is hydroxycitric acid. This does in fact have active mechanisms in the human body by which it modulates serotonin in the gut and fatty acid regulation. The rind is actually grated off in particular parts of Southeast Asia and used as a flavor in fish curry because it's very tart. In general, the studies have shown that Garcinia cambogia is minimally effective in the sense that those best randomized controlled trials that have been done show very little weight loss, and in most cases it's not statistically significant. On the other hand, it's likely cardiac safe. There's no particular mechanism by which this works. There's no evidence that it causes cardiac disease, and so it's something that you can consider doing. Personally, I think that it would be a waste of money, but you know, it appears to be safe. All right, Hydroxycut is an excellent product. As you can see, this is Hydroxycut Hardcore Elite. The more strong words we add, the better off it is. I would imagine that this particular black bottle that says it's hardcore is probably being marketed to young men, extreme energy and weight loss. So these have a number of different extracts. One of them is what we just talked about, Garcinia cambogia, but a couple of other things as well. The issue with Hydroxycut is twofold. One is that they tend to contain significant amounts of electrolytes. And so to cause electrolyte abnormalities that could make someone prone to having issues with their ion channel and their arrhythmia seems entirely possible. Now, are there vast numbers of reports of this occurring? No, there are not. On the other hand, there have been clear reports of hepatotoxicity in young, healthy people who take this. And so in general, I would avoid it both from the electrolytes and from the hepatotoxicity standpoint. Okay, Orlistat is the generic name of Ali, I think is one of the brand names. It is a prescription weight loss agent that actually prevents the breakdown of fat inside the gastrointestinal system. So rather than absorbing that fat, it just goes straight through your gut. It's probably effective and it's probably safe. On the other hand, the side effects that are associated with it are really quite not very nice in many folks. Because you do not absorb that fat, it then passes through the gut and causes significant amounts of fatty stools, which can cause frequent BMs, frequent loose BMs, and a fair amount of flatulence as well. One of the things that some of the studies brought up with that, if it goes very, very poorly when you eat a large amount of fat, then that may encourage a low-fat diet. So Orlistat is probably effective, it's probably safe, but it's not necessarily entirely pleasant. Meritrim. All right, so Meritrim is actually a mix of two herbal agents, typically. Again, remember, I'd encourage you to take a look at what's actually in anything that you're going to take and consider the individual ingredients. One of these looks a fair bit like a thistle to me. This actually alters fatty acid metabolism. So there is one study that had strict caloric control. So individuals were assigned to only take 2,000 calories a day, and they counted them and they helped control their diet in healthy volunteers who were overweight. Those persons who were, there was a randomized double-blinded study in which one group got Meritrim and one group got placebo. And the healthy volunteers lost 10 pounds more in 2 months who were on Meritrim. So it appeared to be effective. It's perhaps safe. I would argue that it's probably safe, but the data is relatively small. This one randomized controlled trial was well done. On the other hand, it was paid for by industry, and it wasn't they actually took and extracted the both of these plants themselves and then gave very, very controlled amounts to their healthy individuals. And so the argument could be made that you might not get the exact same amount of a particular herbal substance, but this is one that I think is actually appears to be safe and which may or may not be helpful, but which the evidence shows is most likely somewhat helpful. Okay, then we have glucomannan. So this is an elephant yam, and the fibers from within this yam are actually extracted. And then what you do is you take capsules of this about 30 minutes before you eat, along with a fair amount of water. And literally what it does is swell up and fill the stomach in a way that feels heavy and substantive. So the idea is that it decreases appetite by sort of sitting on your stomach good and hard and heavy. And it appears to be somewhat effective because it decreases the amount that a person eats if taken in an appropriate manner. And because it just sits in the gut and then passes through, it probably is safe and reasonable to use. It does cause bloating, as you might imagine. Anything that's going to specifically designed to swell up inside your gastrointestinal tract may occur that. And of course, your stools will be soft, probably in a somewhat similar manner to if you were taking Miralax or polyethylene glycol. So glucomannan is somewhat effective and very likely safe as well. All right, and then we have bitter orange. So bitter orange contains synephrine, which is very much like ephedrine. It is a stimulant, and I would not ever take bitter orange or ephedra or mahuang or phentermine or any kind of stimulant for weight loss without the very express permission of your electrophysiologist. And that is because of those stimulant-like effects. The drugs have to be really carefully balanced with a risk-benefit ratio, and they need to be used in a way in which you know exactly what dose you're getting. And unfortunately, the stimulants, you really don't know what dose you're getting. So that is something I would never ever use. All right, let's talk about a few performance enhancers. So the first one, of course, is caffeine, which you're all familiar with. This is an adenosine antagonist, and it does boost metabolism and perhaps cause fat burning. But we're all familiar with the side effects of having too much caffeine, right? You get jittery, you get anxious, you get insomnia, you get nausea, you get relaxation of all your sphincters, so you can have pruritus ani and you can have GERD. But caffeine is probably safe in reasonable doses. You know, the dose for someone with an ion channelopathy may be different from a normal healthy individual, but it appears unlikely that in sort of the amounts that you get from tea and coffee that it's going to be problematic. Now, you know, when you're talking, I have definitely seen individuals who are young and healthy die from inappropriate use of pure caffeine because it is incredibly easy to overdose and to not get your dose correct. And the amount that it takes, you know, is on the order of milligrams to 1 or 2 grams in order to kill an individual. And so one of the rules in toxicology at all times is that the dose makes the poison, right? And so in reasonable doses, caffeine is probably okay to take. What about shrooms or microdosing psychedelics? So this has become quite popular, particularly coming out of Silicon Valley with folks. Their psilocybin actually takes and regulates serotonin, changes serotonin levels inside the human brain, and causes alteration of consciousness. The idea is that it rather than just causing hallucinations, that if you microdose, you may increase the amount of creativity and activity that you can do with this. In general, when you see the shrooms that are psilocybin ones, they tend to have long, thin stems. These are actually on the shortish side. They have thick brown tops, and then they tend to actually be a little bit bluish where they've been bruised. And you can kind of see that in this image and in some other ones. There's no clear consensus on the benefit for these. The issue is that in the 60s, there was a really significant move towards stigma, and there was a lot of political issues involved with, you know, like psychedelics and marijuana and cocaine and heroin and all these things sort of just got mixed up together. And that basically limited the number of studies that were done for the next 4 to 5 decades of time. The dosing that you get from using a shroom, as you might imagine, is fairly inconsistent, particularly if you use extracted versions rather than the mushrooms themselves. They're likely safe because of their action on serotonin almost purely. So I doubt that they would cause issues, particularly with ion channelopathies, but you know, the benefit is unclear. I have never tried this, but part of me actually kind of wants to and see what happens in a safe and thoughtful environment. Okay, so then we have sundry other supplements that we're going to discuss. So beetroot came up a couple of times. So beetroot is an antioxidant. Maybe it improves blood pressure somewhat. It doesn't appear that it actually has any outcomes in those randomized controlled trials that have been done beyond just having a varied diet. But on the other hand, beetroot is probably safe. It's probably fairly benign. And if you believe in beetroot, then power to you. And I have no issues with that being used. Birth control and other hormones came up. So this is one of those more medical ones. Generally, they're safe. The QT effects of sex might be modulated by estrogen, but we actually haven't even demonstrated that. There's studies that are going on. We know that women tend to have longer QTs than men at baseline, and they tend to be more prone to prolonged QT syndromes if we just take folks in general. But in reality, we don't actually know if that's an estrogen effect, testosterone effect, or something that's sex gene related that is entirely outside the realm of steroids and hormones. So there's no evidence that using low dose oral contraceptives for birth control or for acne control or control of heavy menstrual cycles is unsafe. And I would, if this was, a child of mine, I've got 3, I would not, and they had a long QT or other channelopathy, I would not hesitate to let them use this in a safe and reasonable fashion. Green tea. So green tea is an interesting one. It has widely touted benefits, both from the antioxidant effect as well as the little bit of caffeine that's in there. There have been a lot of studies that have been done on green tea because it's not a controlled substance. It hasn't had a lot of the issues that are present with some of the other psychoactive substances. And so, frankly, those trials that have been done in the best, most thoughtful manner have not resulted in any statistically significant outcomes. But it is almost certainly safe at normal dose. It's been used in huge amounts over long periods of time. And so if you think that green tea makes you feel better or live longer, then power to you and go for it. Next up is grapefruit juice. So grapefruit juice is an interesting one. I live in Phoenix, Arizona, so we have a lot of citrus here. And it's basically grapefruit season right now. I actually ended up with, I think I got something like 10 grapefruits handed to me at church on Sunday. By a very kind individual. So we've been having a lot of grapefruit aid in our household this week. But grapefruit juice in and of itself is perfectly safe, but it does dramatically change the liver metabolism of some kinds of medications. This is through CYP3A4, which is one of the most common liver cytochromes that changes drugs. So drugs are taken orally in many cases. It then passes through the stomach. It goes through the liver on the way to the rest of the body. And then the liver helps in the elimination of various drugs. And so if you are not drinking grapefruit juice and you're doing fine on your medications, and then you suddenly go and drink a bunch of grapefruit juice, that may dramatically increase the amount of those drugs that's inside your system. And so you can easily look up if a drug that you are interested in has high amounts of 3A4 metabolism. On the other hand, it may just be good to use caution and avoid grapefruit juice entirely, because there are lots of things that you can drink that are actually quite nice. And if you're on those drugs, then it can be particularly problematic. We've had a number of questions about essential oils that have come out. Essential oils are essentially just extracted plant oils. They are very safe with dermal exposure, and with vaporizers, there's relatively minimal systemic absorption. So some people will, apply to skin, and others will put them in a vape. I'm not talking about a vape like you inhale out of. I'm talking about like a room vaporizer, right? A vape that you are using and inhaling the entirety of it into your lungs is an entirely different issue. But if you take them orally, many of them will cause liver and kidney damage. And that's just the way it is. So these are not meant to be used in this kind of dose in an oral manner. So I would always discourage folks from taking them orally in general, frankly, as well as for those who have SADS. Cesium chloride is another one that I was going to bring up because it has been utilized in detoxification regimens. It's one of those things that kind of like magnesium chloride, which will make you poop a lot if you take it. And so that's why it's used in detox regimens. You should never, ever, ever take cesium chloride orally, no matter who you are. And that's because it goes in and directly blocks hERG channels, and it will cause QT prolongation and torsade in individuals, almost everyone. There's been folks who have been exposed to cesium chloride in fracking fluids. So when you're doing fracking and extracting oil or natural gas, if those fluids which lubricate those machines, the hydraulics have exploded in some cases and covered individuals in those oils, and they've actually had prolonged QT and torsade from even dermal exposure because it's so significant. The reason there's an SR-71 Blackbird on this is because in the Cold War, the United States actually developed a fuel which contained a large amount of cesium chloride in it that was designed to be burned inside the SR-71 Blackbird as it flew over, with the idea being that cesium is actually radio opaque. So you would be burning this massive plume of radio opaque material behind your SR-71, and no radar guided missiles would ever be able to find their way through it in any way, shape, or form. And so that was an interesting use of cesium chloride in the Cold War, although other than a couple of test flights to make sure that it wasn't going to just destroy the engines, as far as I know, it never saw any actual use in and around the USSR. All right, this is a picture of my backyard, not quite my backyard, but around the corner. So Arizona is a great place to be, and I enjoy being here. I am going to start at the top of the chat with the questions. Do you, Marcia, do you want me to just work my way through, or do you have
we have been keeping track of all of the ones that have come, so we will just take them in order.
Okay.
And I can read them to you if you like, if that'll be a little bit easier.
Sure.
So the first one that we have here is a couple people are asking about the option to use CBD products with long QT type 1, and then along with that CBD with THC. Yeah.
So as far as we know, the use of marijuana, whether that is a CBD extracted product or whether that's marijuana with both THC, which is the psychoactive part of the drug, and the CBD, which is less psychoactive. As far as we know, that is reasonably safe inside long QT syndromes. There doesn't appear to be any obvious action on cardiac ion channels. And while I would emphasize reasonable doses because of the increasing amounts of cannabis-associated emesis syndromes inside our society, and because versions of cannabis are now available that have a lot more THC and CBD in them than was ever inside our uncle's joints in the past. I encourage regulation of dose, but as far as I know, and as far as the evidence demonstrates, that is safe. I have seen a lot of people who are using cannabis and have had other things happen to them. I've never seen anyone with an arrhythmia from it.
All right, thank you very much. All right, a question from Sandy. Is there danger with drugs used for diabetics now for obesity like Saxenda with long QT?
I have to look up what the generic term is for all of these drugs. I'm sorry, I'm just looking. Oh, it's a glutide. Okay. So the question was danger with drugs like this. So far as we know, the glutides appear to be safe. They're relatively new drugs. They're very popular to use right now, but let's see, just double checking one that we recently reviewed right now. but none of them have been listed thus far. Now, on the other hand, when you have a new drug, it's always reasonable to ask, hey, is there an older drug that we are more familiar with the long-term safety and efficacy of it in order to use? And I would encourage you to use things for which we have had 10 or 20 years of evidence. That's what I would do with my kid or myself. But to the extent in which we have reviewed them to this point, glutides of all kinds appear safe.
Okay, thank you. From Shelley, what's the safest drugs for fungal infections?
Fungal infections are hard. I assume that we're talking about a systemic fungal infection as opposed to a topical one. If it is a topical infection, like it is, ringworm, or it's a vaginal yeast infection, then I would definitely encourage the use of topical antifungal regimens for all of those, because they are going to be by far the most safe. There's relatively little systemic absorption with those, and there are options for all of those things. Now, if you have a systemic fungal infection, presumably you're incredibly ill and you are probably in an ICU. And then you can most likely use some of those things even that are on the known risk list, but with really carefully monitoring and electrolyte balancing and such. All right, I'm just going down. So I see everyday treatment of asthma as being the next question.
That's correct.
So I would recommend a couple of things. One would be inhaled steroids. So inhaled corticosteroids are incredibly effective for long-term treatment of asthma with relatively low systemic absorption, and they are quite safe. I would try to get anyone with long QT syndrome that I'm treating into really good control with inhaled corticosteroids and maybe one or two other oral agents, and avoid albuterol to the extent that we can, right? Albuterol in many cases has to be used as a rescue drug, but I would make a greater effort to get everyday asthma controlled really well, even more so than other folks.
Okay, thank you. So this is a specific question. Is Scratch Lab hydration drink mix safe? How about collagen peptides powder?
Well, I am looking at Scratch Lab hydration drink right now because I have no idea what is inside of it. So just a sec. I guess I have seen these somewhere. Let's see what's inside you.
Hi, this is Karen. I put that up, and I'm a nutritionist, and
Yeah.
they're pretty low levels of electrolytes. Like one serving is 38 milligrams of magnesium, 44 grams of calcium, and 76 potassium. I have long QT5. I just exercise a lot and perspire, and I just drink water, and everybody's saying, not doctors, but friends are saying, why aren't you replacing with electrolytes? And you mentioned earlier, beware of electrolytes, but this doesn't seem like very high levels.
No, I mean, when we're looking at hydroxycut, we're talking about huge quantities of electrolytes, like super physiological levels. As I look at this, and I'm looking at what it says is inside of it right now, you're right. It's probably incredibly benign. On the other hand, if you're running marathons, then probably it's safest to use some amount of electrolyte replacement.
I'm hiking like 2-3 hours in the summer. That's it's a lot of water loss because
that is a fair amount.
Yeah.
And so I think that the use of this, or frankly, even Gatorade, particularly at half strength.
I can't drink Gatorade. I have colitis and I have to do Gatorade every year for my colonoscopy. A little too much info there, but I just can't face it if it's not that. So that's why a friend gave me this because it doesn't have stevia, and I don't like the taste of stevia.
Yeah, I've been there. I did a rim to rim once that was powered by in the Grand Canyon backpacking that was powered by way too much orange Gatorade and Cliff Bars. And to this day, I have a hard time facing either of those items after
Right.
basically consuming them nonstop for 3 days. So I can't imagine a colonoscopy is that much different.
Right.
Collagen peptides powder, I also do not know, but based on what I suspect is in there, I think that it's most likely safe.
Yeah, there's spirulina, and then this is a vegan one. So there's just digestive enzyme, amylase, cellulase, lipase, and protease, and then the hydrolyzed collagen peptides, 7,500 milligrams. But I've never heard of a problem with these with long QT, but I just thought I'd check.
Yeah, I mean, based on what should be in them, I think that it's likely safe as I'm looking at both the active and inactive ingredients. With the recognition that I would always take a look at the particular type that you're using. That's true for basically everything.
Right. Okay.
So semaglutide was the next question. We did talk about the glutides. There's some evidence that they're helpful so far as the ones that we have reviewed and the evidence that's currently available, they appear to be safe from this perspective. But they are relatively newer agents compared to something like metformin, for instance. And they also tend to be a little bit more expensive in spite of insurance. Let's see. Isogenics Plexus or Advocate. Is that like Advocare?
It's Advocare. I did the wrong letter.
So, the honest truth is that I would be very careful with these things. I have known folks who have been involved with Advocare, for instance, for 25 years now. And these things tend to be lots of mixes of various substances, and they tend to, what I've seen is that they have one kind of stimulant in there, and then when we find out that one kind of stimulant might kill you, then they switch to a different kind of stimulant, and then we find out that that stimulant isn't actually different, and then they switch to the next one. So if it's anything that says like this is for energy, I would probably not take it because I would be nervous about the likely having some kind of herbal stimulant, even when I'm not aware. And I know that these groups have changed their products over years and they've tried to make them safer, but in some ways it sort of feels like rearranging the deck chairs on the Titanic to me, I'm afraid.
Okay. I don't think he's taking anything that has the stimulant in it. I think he's just doing like the fiber and the vitamins and stuff like that, but I'll double check.
Yeah, I would encourage, caffeine appears to be the most safe stimulant in this case. And so a little bit of extra caffeine and things is okay, but I would be nervous about these kinds of products. Those that, especially since they're marketed for sort of like energy and weight loss, anything that's marketed for that, you would want to pay special attention to.
I guess the second part of that same question, which allergy medications are safe?
All right. Oh yeah, allergy medicines. So we actually have a list of this specifically on the therapeutic options that are not on it. So things that are not on the list include things like cetirizine and loratadine and doxylamine. So basically anything that's not like straight Benadryl, diphenhydramine, or terfenadine is pretty reasonable to use. So my first choice.
Could you tell me the actual names, not the what those are?
So cetirizine is what is it? Zyrtec, and its versions thereof.
Okay.
And then loratadine is Claritin.
And those are safe to take?
Those have been reviewed and appear safe. Yes.
Okay. Thank you.
Okay. The next one from Catherine, particular medications typically prescribed for acne that should be avoided for long QT.
Oh, yeah. So in general, we want to avoid erythromycin and sulfamethoxazole. So erythromycin is one that's relatively common. The other things actually that are most commonly prescribed for kind of like from a physician, they tend to be other antibiotics like minocycline and doxycycline, which those are the generic names, but those are the way that they will always be bought because they're super old ones for which the brand name has been long forgotten by anyone. And so though doxycycline and minocycline and clindamycin are three of the ones that are often chosen, and they appear to be reasonably safe. In those folks who have really severe recalcitrant acne, they oftentimes go on a vitamin A thing that has isoretinoin or retinoin of some kind inside of it. And that also appears to be safe from the perspective of QT prolongation. It's very important that those individuals, particularly young women who are placed on that, have two forms of birth control because retinoids cause incredibly bad birth defects. And so it's critically important when you're taking those kinds of things to not get pregnant.
Okay, thank you. So Sophie asks, is evening primrose oil safe for long QT?
If we're talking dermally, yes. If we're talking about orally, then no. And that's because of hepatotoxicity as well as potential issues with long QT. So if you're going to put it on your skin, great. If you're going to put it in your mouth, not so much.
Mm-hmm. Okay, Jessica says, does CBD, THC block the potassium channels?
No. Cannabis and cannabinoids in general act on, we actually have cannabis-like receptors inside our brain that we use for particular psychoactive signaling and signaling inside of our gut and inside of our brain. And that is not engaged with potassium channels any more than any other cellular receptor is. And so everything that I have seen doesn't say that there's any particular issue with long QT and cannabis. As you know, the medical trials on cannabis are still somewhat limited and are consistently coming out, but that would be my initial take.
Okay, thank you. Jenny asks, what decongestants are safe?
Yeah, so this one is also on the therapeutic options list if you want to go back and take a look at it. But in general, those things that are like Sudafed and ephedrine and promethazine should be avoided. The decongestant, so guafenicin, which is Mucinex, is likely safe. Personally, I don't take that because I think that it's sort of silly and that it doesn't really do much in randomized controlled trials, but it's safe. And I know people who sort of swear by Mucinex products. And so that would be a reasonable choice to do.
Okay.
And we talked about allergies stuff already.
I guess part of the question that I had with that was that we were told that she just can't do whenever it says D. So like she can say Claritin, just not Claritin D. Is that?
Yeah, that is true. That is
kind
true.
of follow that method?
The D means that it contains Sudafed or pseudoephedrine, and that is generally the one that you have to go to the counter to purchase because it can also be used to make meth. But if you avoid the D formulation, then you're safe.
And Benadryl is completely out and Sudafed is completely out.
Again, with the same things that we said before, I think that in the case of Sudafed and diphenhydramine or Benadryl, that there are enough alternative options that you can choose other things to use.
Thanks.
Yeah. All right.
Okay.
Horny goatweed sounds like a really good name of something. As you might imagine from the name, horny goatweed is more about erectile dysfunction and sort of sexual performance than it would be about weightlifting. So I don't know exactly what the idea is for that, but it is active on certain cardiovascular cells. And so I don't know any particular report of horny goatweed causing issues with SADS disorders, but I don't think I would do horny goatweed personally because of its effect on blood vessels. It may be safe, and again, I don't know of any reports that you can look at and say, hey, look, it's killing all these people, here and there or anything. But if you want to try taking something else, I think that's reasonable. Creatine is fine. So creatine is just lots of protein, basically, and is okay. But again, the problem with creatine containing mixes is they tend to be mixes, and so you got to look at what other kind of, pardon my use of the word, crap is inside those. I've seen ones that are very reasonable and some that are quite problematic. Salt tablets. So salt tablets probably are safe in reasonable amounts, particularly if you're replacing something when you're exercising. An attempt to maintain normal homeostasis of electrolytes is good. Just taking a salt tablet, I assume no one's taking salt tablets just for kicks. And so that is probably just fine. Seasickness. Okay, so let me think about options for that real quick. So scopolamine is quite commonly used for seasickness. I have to look. Just a sec. Let me think about that. It's not something that I think about every day. So we reviewed scopolamine, and we did not classify it. So scopolamine is probably a reasonable choice. Scopolamine has been around for many, many decades, and I suspect that if it was going to be problematic, then we would have found out that it was in fact that. So scopolamine would be my suggestion. Okay, so vaccines, cumulative effects of mRNA vaccines, getting more than 3. So far as we know, when someone gets an mRNA vaccine, it appears that with the mRNA is actually entirely eliminated in any way, shape, or form from inside the human body in approximately 2 weeks. So as long as you keep your shots 2 weeks apart, then you're in pretty good shape and you're probably not accumulating any mRNA. So far, the benefits in folks who are older in receiving a 4th booster appear to be more beneficial than risky. Who knows, maybe there is some quantity of mRNA vaccine which is problematic, but as long as it's more than 2 weeks, so far everything that we know demonstrates that that's safe. Medicinal mushrooms. Okay, so mushrooms are interesting. I met some folks once from Eastern Arizona who had been told which mushrooms were safe by a Russian mycologist in the 90s in Eastern Arizona. But as you might imagine, if they were coming to see me, that was because they were wildly hallucinating and had eaten the wrong mushrooms. So it turns out that you can't trust your experience with Russian mycologists from 30 years ago. In a similar way, trusting medicinal blends of mushrooms can be reasonably problematic. I am unaware of any evidence that demonstrates that a medicinal mushroom combination is in any way helpful for immunity or for any other disease state. But that doesn't mean that there isn't a trial out there somewhere. But so far as I know, it doesn't really do much. Medications for UTIs. So again, I would direct you to the therapeutic options. The things that you want to avoid are floxacins, fluoroquinolones is what we call them. So ciprofloxacin, levofloxacin. The things that appear to be safe are many: ceftriaxone, nitrofurantoin, amoxicillin, any cephalosporin. What else is commonly used? Bactrim is probably another one you should avoid. Just again, there's lots of options, right? If it was sort of Bactrim or nothing, then it would be a risk-benefit balance. But I would encourage probably the use of ceftriaxone in those sort of resistant ones, and then cefazolin or amoxicillin in those which are not terribly resistant. If it's recurrent UTIs, then what you should do is look at your culture with your electrophysiologist in order to discuss those ones which are going to be most likely helpful for you if you have a recurrent UTI, because it tends to be the same bacteria again and again. Let's see, precautions with being in ketosis. Okay, good question. So being in ketosis means that we've shifted the metabolism of our body more toward fatty acids and less toward the use of carbohydrates. As long as you're in ketosis and not acidosis, so as long as you don't take it too far, it doesn't cause really significant electrolyte shifts inside of human beings. If you push it to the point where you're starving, then you will start to have significant potassium and phosphorus abnormalities, and you can potentially put yourself at pretty high risk. So ketosis is okay, starvation is not. So, you know, find that fine line, which isn't really that fine of a line. Just as long as you're eating something, you should be okay. I am not familiar with is alcohol. Is that? I honestly do not know what that is, but I will see if I can find something in the resources that I have. I cannot find that word. Is that a, maybe whoever that is can kind of help us out.
Hi, I meant to type alcohol, not whatever I wrote.
Okay,
So
all right, good. I thought this was something. All right, so alcohol is fine, again, in reasonable use. Large amounts will drive metabolism shifts away from the use of electrolytes as well, or I'm sorry, away from the use of carbohydrates as well, and therefore may cause electrolyte abnormalities. But in normal use, which is whatever is defined as healthy drinking, which is, you know, like 1 or 2 drinks a day and no more than 5 at a time, and, you know, several days a week is just fine, and it should not in any way interact with the beta blocker. Will there be a database with supplements? There may be someday. It took us a long time, frankly, to get even the therapeutic drugs list done. So I wouldn't hold your breath, but we would love to do it at some point. Alcohol, there it is. Okay. All right. So quercetin, NAC, CoQ, stinging nettle, and bromelain. The first 4 are fine. Let me just double check bromelain, because don't talk to people about it on an everyday basis. I don't see any evidence that bromelain causes issues. I also don't see any studies in which it's been carefully looked at. I mean, apparently it usually is used as a preservative and things. So I'm unfamiliar with the use of bromelain for health and wealth, but I do not see any evidence that it's problematic. Oxymetazoline is in fact problematic. So I would not use oxymetazoline, and that is because of its vasoactive properties. So oxymetazoline is actually goes in and changes the signaling of epinephrine and norepinephrine inside nasal tissues. That's what it's designed to do. But there is a fair amount of systemic absorption, and if so, I would avoid the use of oxymetazoline, which is oftentimes an Afrin type products or whatever the generic Afrin kinds of things are. I don't think that's worth it. It can also, if in regular use, it also causes rebound flushing of those tissues. And so in general, I think the oxymetazoline is more work than it's worth, even for normal people. And it's not recommended for those with QT prolongation and other ion channelopathies. I was going to say something else. Oh, you know, if you like roofies, well, not roofies specifically, but oxymetazoline is so vasoactive and such amount of systemic effect that it's actually what is sometimes used as a date rape drug. A few drops into a drink can cause significant decrease in consciousness. Let's see, methylfolate is safe as far as I know. I am unaware of any particular issues with it. We kind of talked about seasickness. Scopolamine is probably the best choice because we've reviewed it. I will double check meclizine. As far as I know, we reviewed it and it wasn't classified as well. Yeah, so meclizine is also okay. Chlorophyll for acne, I'm unaware of the evidence that demonstrates that that's particularly useful, but it should in fact be safe. Alcohol while taking nadolol is okay, again, in reasonable quantities. And I would generally try to separate, drugs that you're taking from other things. I'm good to keep going, but if we need to end, I think that this was technically over, Ms. Baker. I'm not sure.
You're right. We had scheduled for an hour. Maybe we can get through a few more if you have time.
All right, let's fly. Shingles vaccine is safe. Accutane is okay. We talked about some of the issues with pregnancy with that. Taurine is basically a lot of caffeine in a herbal formulation, so it doesn't actually just say it is caffeine because it is taurine, but in reality taurine is caffeine, so same thing for that. Just avoid the amounts. Oh, boron. Let me double check boron. The vitamins are okay. Boron is pretty benign and not terribly metabolically active, so it should be okay. Butane, we already did that one, right? Yes. Beta blocker to become ineffective over time, resulting in the need to change. So I'm not going to say that it's impossible, but it's fairly unlikely. The receptors for beta blockers, which are beta adrenergic ones, are generally not downregulated in human beings, and you're just blockading them. You're not actually, changing the amount of signal that can come through when it's not blockaded. So while changes in other meds and your life and your size could result in needing a different type of beta blocker, in general, I don't think that there's any evidence that they become particularly ineffective over time. Medication to eliminate hangovers, water and coffee and acetaminophen are pretty good. I probably would just stay away from everything else. Melatonin is safe. I don't know what Prevagen is. IV immunoglobulin. Okay, so that's one of the brand names for one of the IV. So far as we know, the Prevagen is, which are we talking about, with an O or with an A? We should just clarify that, because Prevagen with an A is immunoglobulin for COVID-19 and is most likely safe so far as we know. Prevagen, let's see. I'm unaware of any evidence that Prevagen is not safe, and I'm looking right now and I don't see any that immediately comes up, but I think there will be questions about the efficacy of that one. Probiotics are in fact safe and reasonable, and Diet Coke should be fine other than the caffeine. I'm unaware of any inactive substances that is that. we
Dr.
are.
Heise, I had one more question that came in through a registration comment from Nicole. My spouse and I have 2 children with long QT type 1, and I'm breastfeeding my daughter and looking to determine what, if any, anxiety medications are long QT1 safe and that can be passed on during breastfeeding.
Yeah, so there are really good resources that you can use to determine if, and I'm trying to remember the name of one of the websites now, similar to Credible Meds. There's a couple of really excellent websites that are not springing right to my mind right now, which are very useful for determining safety of drugs for pregnancy and for breastfeeding. And so I would encourage you to take a look, to find those websites, which unfortunately are not springing to my mind right at this moment, and to take a look at them and see what the recommendation is and how much is passed through. On the other hand, if you are taking those agents, if what you're particularly worried about is long QT, if you're taking those agents like buspirone or duloxetine, which have been reviewed and there's no evidence of toxicity, then it should be reasonably safe because your infant is going to be getting a much smaller dose than you are.
Okay, thank you very much, Dr. Heise. I think we'll conclude there. And if there are any follow-up questions, we can just forward a couple to you, maybe if we have that opportunity.
Sure.
So I appreciate your time and your expertise and some very specific questions from all of our family members. So someone just posted mothertobaby.org.
Oh, I think that might be one of them. Yes,
That's
thank
one
you.
of the website. Thank you,
Yep.
Serena. Okay. All right. Well, thank you everyone for joining us tonight. We appreciate your participation and all your questions, and watch for the recording will be sent to all of you who have registered, including all those online today. So have a good evening. Thank you.